everyone, I'm Abby, and I'm going to introduce you to the new baby warmer that's going to be in ER. First, I'll go through, show you where all of the functions are on the bed, and then secondly, I will walk through and show you how to use those. So to start off with, I'm going to turn the bed around, show you the back. On the back of the bed, we have the gray power cord, we have the green oxygen cord, and the yellow medical air hookup. To the back of the bed, we do have medical air and we have oxygen. I'm aware that you don't have medical air down in ER. This bed has a capability to blend oxygen to where you don't need to deliver 100% if you don't need to. So to utilize these, you would just take the lever and then turn it to the right. The difference between medical air and oxygen is that medical air delivers 21% oxygen and then the oxygen tank delivers 100%. So I will show you guys the blender on the front of the bed here momentarily. I'm going to turn this back around. Okay, to the front of the bed, we have a screen that lights up and it does have options on it and it prompts you to do things as well. We have the white power switch, we have a light dial, there's an alarms off button right here. There's a panel that has your suction and your oxygen. If you were looking toward the bed, on the left side, there is suction that is attached to the bed as a delete. There's also an SpO2 monitor. It's Masimo, and it does say Masimo on the bed so that you don't need to try to figure out which one you need to use. It tells you. On the right side of the bed, there is the oxygen tubing and the non-disposable thermometer that you would place on baby. We have an OB precipitous pack up here. This has all the delivery instruments needed. And you would also need to grab a set of sterile gloves for doctor and a gown for them to wear to protect themselves. I'm going to turn this around a little bit and move my camera because there are some things down here at the bottom of the bed I want to show you. So there are two drawers on the bottom of the baby bed. They're accessible on both sides of the bed. In the top drawer, we have an umbilical cut down catheter tray. It's sterile. There's a kit for the umbilical cut down tray. And then we have 3 different sizes of umbilical catheters. This would be if a baby was really hard to start and doc wanted to start an umbilical catheter. The bottom drawer is a larger drawer and it has all of the supplies needed for the bed so that you don't need to run and grab more. There are extra SpO2 monitors, cord clamps, the little NeoGuard heart stickers that go over the thermometer on the baby's belly, hats, blue bulb suction, syringes, more oxygen tubing. This will be where your saran wrap is for your preemies, and the warming mattresses as well. To the bottom of the bed, we do have 2 pedals, one to raise the bed and one to lower the bed. To the front of the bed, there is a metal bar, and if you grab this bar and you pull it towards you, you're able to then tilt the bed. Just makes it a little bit easier to work with the baby. I'm going to turn this around and I'm going to move my camera one more time. Okay, to start off using the bed, go ahead and use the white switch, on-off switch. Now, if you hear that there's a bad baby coming in, you hear there's a delivery that's going to be coming in, then you're going to want to go ahead and come in, turn on your bed. Once you turn on your bed, it takes a few moments, and then it will start warming at 100%. If you don't do anything with the bed for 10 minutes, then it turns the heater down to 50%. And it will just stay at 50% as long as you leave it on, okay? Now, if you want to do anything more with the bed, you're going to want to use the admit baby button here, okay? And then there's the heater power settings. So right now, we'll just we'll just pick 100%. You just press the up button, and then you're able to adjust it down all the way past 25% for heater power. There are 2 modes, the manual and baby mode. So the manual would be taking the 100%, adjusting it down to 50 if you wanted to. If you're gonna have the baby on the bed for longer, for any length of period of time, you're gonna wanna definitely use the little non-disposable thermometer that goes over baby's liver, and then you use one of those NeoGuard heart stickers, the reflective stickers, right over the top of that. You would pick mode from manual to baby, and then you set it at 36.5 degrees Celsius. 36.5 degrees Celsius is 97.7 Fahrenheit. And then you would want to adjust this temperature off of baby's temperature. So let's say that you took baby's temperature and it was 97.2 axillary. Well, go ahead and turn this up to 37. And then recheck temperature after a couple minutes. You never want to use the temperature off of here as a reliable source. This is just to adjust the temperature according to baby's temperature. Underneath the thermometer, the temperature settings, there's an SpO2 setting, okay? So the SpO2, you would attach to the right wrist, and that would give you your preductal SpO2, which is the most reliable source on an infant. That is the oxygenated blood going to the heart. So you would pick on, and then it would give you a pulse rate and an SpO2. Now, underneath the screen, we have a little cheat sheet, and it says targeted preductal SpO2 after birth. So a fresh delivery, a fresh baby, we would expect at 1 minute that their SpO2 would be between 60 to 65%. And then at 10 minutes, we're expecting 85% to 95% SpO2. So it takes a little bit of time for a fresh baby to transition to breathing in the outside world, outside of mom. At the top of this screen, we have an APGAR timer, and you can turn that on, and it just starts counting. So as soon as baby's born, go ahead and hit the APGAR timer, and then you'll know when to do your 1 minute and 5 minute APGARs. It'll also help you keep track, like if you're doing any kind of PPV or blow by, it'll help you keep track of how much time has passed since you've been doing that. It's very helpful. It'll just keep counting until you turn it off. Okay? So this panel right here is your suction and your oxygen. So the suction is on the top, it's the top toggle switch right here. And to test your oxygen, or your suction, you'd occlude your tubing, and you want it between 80 and 100. So I like to set it at 90. There's a dial right here, and you're able to turn it up or down. Just keep it right at 90. You have a DeLee on here, so you're able to pass this down baby's nose, baby's throat, occlude, and suction. I'm going to move my camera over here so that you guys can see the oxygen settings just a little bit better. Okay, so the middle of this panel is all things oxygen. I'm going to turn that on. The first thing that I want to do is make sure that my oxygen is set at 10 liters per minute. Okay, so right above the tubing, there's a dial. We just want to set that at 10. In the middle here is the blender that I was talking about, where you can blend the oxygen all the way from 21% to 100%, okay? So 100% would be like if you were giving a baby CPR. Otherwise, you really want to start out at 21% and then work your way up. This is the PIP dial, and this will increase the amount of pressure that you give, the most amount of pressure that you give with a breath. So I will show you how to adjust the PIP and the PEEP. So I've got my mask on right now, but I'm going to go ahead and take that off. Okay. So PEEP is the bottom of this T-piece, and PIP is the top, occluding both. Okay? So PEEP is the positive end expiratory pressure, and this is the amount of pressure that's left after giving a rescue breath. Okay? To adjust the PEEP, you would turn this blue knob on the top of the T-piece. And it says right on the front, it says PEEP, positive, negative. The PEEP we want at 5, so we would occlude the bottom, and then we would adjust accordingly. So it's set at 5. This is exactly where I want it. For the PIP, which is peak inspiratory pressure, we would want to occlude both sides of the T-piece. Okay, just like this. So the PIP is the greatest amount of pressure that you're going to give with a breath. And we want that to be at 20. So in order to adjust that, you would use this PIP dial right here and adjust to 20. Now, as a safety mechanism, there's a yellow tab right here. If you can go up to that yellow tab and you would be at 30. 30 for PIP. Okay? Now, to get past this tab, you would actually have to press it and move past it. We don't really want you doing that. Let's just keep it at 20. So, to give blow-by, let's say you want to just give blow-by, you would just take the T-piece and hold it over baby, or you could attach it to the mask and hold it over baby that way. Okay? If you wanted to give your rescue breaths, you would do your sniffing position and occlude. Breathe for baby. Okay? If you wanted to give CPAP, then you would just take the mask, hold it tightly over baby's face, and just give that continuous positive airway pressure at 5. Keep the baby's alveoli open. So that was all things oxygen. There is another oxygen port over here. Rarely ever use that. Shut those down. I'm going to move my camera back again so I can show you how to utilize the scale function on the bed. It's very nice to be able to weigh baby with this bed. That way you don't need to transfer baby from the bed to a scale and back to the bed. So to utilize a scale, you don't want anything on the baby. You don't want any diaper, no hat. Go ahead and get baby completely naked. On the bottom of this screen, there's a menu option. So you would hit that. And then there are several different options that you could choose from. There's the APGAR timer, the scale, SpO2. Just go ahead and hit the scale option. And it says weigh up at the very top. Push that. And it says level bed. So make sure the bed's level and you're not touching the bed. And this will continue to prompt you. It says please wait. And now it says lift baby. So you lift baby above the bed without touching the bed. And then it says replace baby. So you just lay baby back and do not touch the bed while it's weighing. It says please wait. And then it says my weight is 830 grams. So go ahead and write that down. And then up at the very top of this screen it says ounces. So you just hit that and it says my weight is 1 pound 13 ounces. So these are the very basic functions of this bed. I know there are a lot more dials and it may look a little bit intimidating, but I can assure you it's way more user-friendly. I think that once you get your hands on it and you play with it a little bit, that you'll feel a lot more confident about it, and you'll see that it's actually easier than the other bed that we were using. So that's it, and if you all have any questions, definitely feel free to ask, and I will show you, and we will help work through this together, get your hands on it, get you feeling a little bit better about it. All right, thanks.